Is caffeine bad for rheumatoid arthritis? Hello, this is Dr. Siddharth Tambar, expert in rheumatology and in regenerative medicine. A question that a patient asked me recently is whether caffeine is bad for their rheumatoid arthritis. To begin with, is caffeine bad for the actual progression or prognosis of rheumatoid arthritis? There's no evidence that caffeine will worsen your rheumatoid arthritis or lead to a worse prognosis or lead to more erosions or lead to more disability. So from the condition itself, caffeine should not be bad for RA. Then there's a question of medications. Again, for the medications that we utilize for RA, namely disease-modifying agents, biologic medications, these are immunosuppressant medications. Again, no evidence that caffeine is directly problematic for the medications that you're taking in terms of affecting the efficacy of the medication, the absorption of the medication. Does not seem to be any issue with that. One caveat to that would be that the medications that we utilize, the oral medications, can irritate the stomach and sometimes cause nausea. And caffeine, depending on how much you're taking and how you tolerate it, can either worsen some of those GI symptoms or actually make them better. So caffeine in that case may have an impact in terms of how you tolerate some of the medication. And then the other sort of one to point out is also the effect of caffeine and steroids. High doses of steroids, and that can include either prednisone, cortisone, methylprednisolone, solumedrol, any steroid. And very high doses of steroids can lead to elevated heart rates and rarely arrhythmias. If you're taking a lot of caffeine as well, that also could increase your heart rate and also make you more prone to arrhythmias. And then the last issue is that RA patients have higher rates of heart disease as well long term, due to either chronic inflammation, some metabolic risks, increases the chance of cardiac risk as well. Caffeine comes in obviously more than just coffee and tea. You also get caffeine in a lot of soda pop, a lot of sugary drinks. And those kind of drinks have so much excess sugar, fructose, they're really not good for your cardiac health and metabolic health long term. So in that case, I would say be careful if you're consuming caffeine in that sort of format, because that's probably not good for your overall metabolic health and your cardiac risk as an RA patient as well. So overall, caffeine is okay in the setting of rheumatoid arthritis. Just be aware if you're taking super high doses of steroids or if you're drinking tons of sugary, unhealthy soda pop. Thank you for your time. Give us a like, subscribe to the channel, and until we connect again, have a good day and live well. Bye-bye.